Hello and welcome. I'm Dr. George Lundberg for MedPage Today, and we're in Chicago where we're taking advantage of the presence of the American Osteopathic Association and its executive director, Mr. John Crosby, to have a chat about osteopathic medicine, how it is and isn't like other kinds of medicine, and where it is and where it's going. So, John, we'll tell the audience that we've known each other for a long time.
Okay.
And we used to work together at that other organization called the American Medical Association.
We sure did. Fond memories.
Years ago. So you've been how many years in your executive director role?
I've been there 14 years. Came over from the AMA in 1997.
97. Okay. Tell our viewers very simply the difference between osteopathic medicine and allopathic medicine. Surely there are more similarities than differences.
Today there are. We were founded by A.T. Still, an MD, back in the late 1800s in Kirksville, Missouri. Our doctors today go through the same education and training that an allopathic MD would do. I'd say the biggest difference is I think we're imbued with a holistic approach to patient care, George, and also we receive additional training in osteopathic manipulative treatment.
Okay, so that's a distinguishing characteristic.
Correct.
But osteopathic physicians can do residencies in anything.
They can. We deliver babies, we do neurosurgery, orthopedic surgery, radiology, anesthesiology. All the major specialties are found in osteopathic medicine, just as they are in the allopathic world.
But am I correct in my belief that osteopathic physicians are more likely to do primary care statistically than allopaths now?
That's correct. We have
Congratulations and thank you, and don't change that.
We won't. We hope not. We have 70,000 DOs practicing in the United States today, and roughly 55–60% are in the primary care fields, and we're very proud of that. And given the workforce problems,
did I hear you say 55–60%?
Yes.
Great.
And given the workforce shortages that we all anticipate, some 80,000 shortage of physicians generally and 50,000 in primary care, we feel like we are filling a big need and a big void in our current healthcare delivery system.
Well, you are, and I thank you. And might I then believe that osteopaths and your organization support a large amount of the Affordable Care Act that has been passed and signed into law?
We did support it. I wouldn't say formally endorse it because there are a lot of things that needed fixing, and they still need fixing.
Okay.
But we wanted to see it go forward. We thought it would be a better healthcare system than we had before. And not only the 32 million Americans that are now going to have health insurance coverage, but for our field, the recognition of primary care, the advancement of wellness and prevention and other healthcare modalities that we are imbued with in our training and proud of, we felt that those were going to be opening doors for us in the future. So yes, we were very happy with it going forward.
So as far as that act is concerned, the notion of repeal and replace, your organization would not favor?
I doubt it. A total overhaul, George, is not going to be either feasible from a veto standpoint or practical. I was in Washington yesterday at the White House. I'm not name dropping, but the implementation of the Affordable Care Act is well underway. Yesterday we were talking about accountable care organizations, the patient-centered medical home, and other concepts that are soon going to be out there in the market and available for doctors to participate in.
Right.
It's going to be very hard to turn the clock back.
Right, but the Obama administration would be receptive to tweaking, I would imagine, like that 1099 problem.
Yeah, that apparently is going to go perhaps in the lame duck session, if not as soon as Congress reconvenes. They are very much of a mind to improve what needs to be fixing, but let's not do a complete overhaul.
But if the Democrats, while they still have control, more or less, in this lame duck, could take control of that and say, we hear you, we need to tweak this thing and get the thing done, so as to say it's not stuck in stone, we're going to make it better, work with us on it. It seemed like that would be politically proper.
Politically proper, and I think and hope that's the way to go. Our biggest fear right now is that we're going to have a partisan gridlock for the next 2 years.
What, in this country, gridlock? No.
Yes. And there's some big things that have to be addressed. As you know, physicians are facing a cutback in Medicare reimbursement of some 25% in the next 45 days.
Going on and gotten fixed, going on, gotten fixed, going on,
Well, it needs to be fixed again.
Yeah,
and
I know.
At the White House yesterday, Nancy Mendaparo said that the president, before he left for India, told his cabinet the highest priority he had from health care was to fix the sustainable growth rate formula. Whether it's a 2-month extension right now, he would endorse a 13-month extension to give us some time to deal with a long-term solution.
Yeah, right.
And the other thing we would very much like to fix, no surprise to you, would be medical liability reform.
It needs to be done, and if the Democrats would ever understand
Yes.
that even though they're all lawyers or whatever relational lawyers, as you are, I know,
Yes.
it just has to get fixed. On the other hand, how to fix it is not all that easy.
No.
And I'm pleased with the demonstration projects that are in the ACA, that some of which might show they actually work, because the lip service type of ways to fix it aren't really likely to fix it. But that's a topic for another time that we could talk about that. A couple of words about the medical home.
Okay. The patient-centered medical home, and I want to emphasize patient-centered.
Patient-centered, right.
I also serve as chair of the Patient-Centered Primary Care Collaborative, a group that includes the major primary care physician organizations like ours, Fortune 500 companies, the major health insurance plans, all trying to come up with a different delivery model that puts the physician as the quarterback of the team, but has a 24/7 relationship with the patient, emphasize and requires the use of electronic medical records, a lot of feedback between the team of providers that would be involved, but all with the hope that we can come up with a different delivery system model that engages the patient at the center and has the team approach, a building block, if you will. I think it's going to be a transformational aspect of healthcare delivery in the next 5 to 10 years.
Well, I fully support that and have for a long time, but my shtick is one patient, one physician, one moment, one decision. Let it be a shared decision based on best available evidence, including how much it costs.
You've got
That's
it.
my Okay, we've been talking with Mr. John Crosby, the 12 or 14 years?
14 years.
14 years, Executive Director of the American Osteopathic Association here in Chicago. Thank you for being with us, and thank you for being with us. I'm Dr. Lundberg for MedPage Today, signing off.